We are now ready for our second session. We have Ms. Ranjit Kaur as our moderator.
Hello everyone, and thank you for having us here. As you can see, this is the first time we've got the stage totally filled up with people. And we have an interesting session, as I mentioned, Louder Together, Calling ASEAN Voices. So the ASEAN Voices you see are on stage at the moment. These are the representatives of the ASEAN Voices. So if I could just introduce right from the other side, further away from me, is Dr. Ramy Roxas, who is from the Healthway Cancer Care Center in the Philippines. We have Budiastuti Wening, or in short we call her Ning, from the Indonesian Breast Cancer Foundation. And then we have Htun, who is a doctor from Shwe Yaung Hnin Si Cancer Foundation in Myanmar. And then we have Carolyn Taylor and Anna. Can you put your hands up so I can know? No. We need one by one. Anna first, and then we need Carolyn Taylor. Both are from the Global Focus for Cancer, or we call them GFC from the USA. And of course, Carolyn, you'll be representing Vietnam as well. I hope so. Yes. Yes, and we have Carmen Auste, who is from the Philippines, the Cancer Coalition of the Philippines. And with us, we also have online speakers, who is Azrul Khalib from Malaysia. He's from the Galen Centre for Policy. Then we have Finola Chatamra, who is the advisor from Queen Sirikit Centre for Breast Cancer in Thailand. We have Professor Imjai Chitaparanarux, who is the Deputy Head Department of Radiology at the Swandok Breast Cancer Network of Thailand. We have our reactors who are present here today. With us, we have Lorenzo Boffi, you're going to put up your hand, Senior Partnership Manager for the UICC, and thank you for being here. We also have Madeleine Valera, who is the former USEC and former chairman for the ASEAN Health Sector. And I think we are proud to have you here because you're a health economist, an important person, HTA Asia, right? And she's a senior advisor to the Union Against TB and Lung, as well as Tobacco Program and NCD's policy advisor to the UK Better Health Program. Online we have Dr. Eduardo Banzon, who will be joining us via Zoom as well. And he is Principal Health Specialist for Southeast Asia Department, ASEAN Development Bank. So welcome to everyone. Now what I decided that I will do after we have had some discussions in the past few weeks was that I have developed a menu. You know, like you go to a restaurant and they give you a menu, then you decide which one you want, which is your favorite food. So here there are favorite topics that we would like to talk. But at the same time, we also need to make sure that we have some kind of collaboration, some continuous working groups that we can form from here and move on, and not just meet once a year and then go back home, you know. So in my menu, I have like, how about clinical trials within the region, a collaborative effort. We have particularly very high numbers of people with metastatic breast cancer. We also have a different ethnic community in Southeast Asia. Maybe their behaviors are different. So perhaps we could look at that. What about studies that can be done? Research studies that can be done collaboratively. I'm sure there are some studies already going on, but let's look at more. How about real-world evidence? What's the patient advocate's role in real-world evidence? And how can we build the capacity in real-world evidence among us, the civil society? Empowering civil society to influence policies. We've been talking a lot about that. But are we doing something about it? Are we there? Are we actively monitoring, say, national cancer control plans within our own countries and comparing it with each other? And sometimes patient advocates do say that you know, we don't have the capacity to do this lobbying. But you need to remember that women in Africa many years ago actually lobbied for clean water and sanitation, and these were just mere housewives. They could do it. How about shared decision making, empowering patients, health literacy, making sure that patients and their families are spoken to by healthcare providers in a language that they understand, in a language that they know, they relate to. And how can we make that happen? How about support and navigation? What about patients as stakeholders? Only if you have health literacy can you be a stakeholder in making decisions jointly with your healthcare provider and accessing treatment. Innovative treatments, right to testing, right to clinical trials. Patients traveling to other countries, I think this is very common in Southeast Asia. Is the grass greener on the other side? I wonder. And then you begin to see the different socioeconomic background of where people are going. Do they not trust their own healthcare providers or their services? So we're talking about trust and capacity here. We're talking about experience sharing. How about stories of breast cancer for the region? Have a joint thing among the different countries. And from there we can see the pattern of how people behave. What are the social determinants? And patient safety as far as treatments are concerned, medicines are concerned, diagnosis is concerned. And let's make it continuous and ongoing. So I spin off. I've given you my menu. Who would like to start? Carolyn?
So I think there's countless ways that everyone can partner together. But I think what we need to do is just start and move forward in a concrete way. There's lots of things that people are doing that are very similar, and how do we look for ways to coordinate that to make a stronger voice for the region, right? So I think there's patient nav, there's different models throughout the region that we could look to, different things like that. Peer support, there's different models being done. But how do we advocate, instead of just looking at that, how do we move it forward and then use what's being done to advocate for more services for the region, for more visibility for the region, for things like that. Anybody want to keep going? Yeah.
Yes, Carmen.
I agree that the important thing is, as they say, stop talking and start doing, right? So that's something that we'll start right after this. The other thing in terms of pathways, you were talking of policy advocacy, is for us to be able to collaborate with the WHO regional offices, both Western Pacific and Sharo, because currently they already have developed a regional framework for cervical cancer, a regional framework for NCD, but not yet a regional framework for breast cancer. So I feel that given that there's the global initiative for breast cancer, that's something that we can follow through. And then in addition as well, asking them to set up a knowledge action portal for breast cancer, because again, they've done that for childhood cancer, they're starting to do it for cervical cancer, and it would be one very good platform in terms of capturing best practices, good practice models, innovations, and of course, the regional partners, the civil society, can contribute there or can have a separate learning portal. The other major group that we can actually approach, because a number of them have offices in the Philippines, shout out to ADB and World Bank and the UN agencies and all the aids, development partners that are here right now, in the context of financing, for them to be able to help us to make a case, the costings necessary, because this is necessary for advocacy to our regions, and as well, part of that is for them to be able to help us to unlock various revenue streams, be it in terms of ODA or part of the budget of the various UN agencies and so on. And finally, really, as you were mentioning, a wider and deeper collaboration, both in terms of national, regional, and international breast cancer groups. In terms of the cancer community, we actually look up to the breast cancer community because we feel your voice are already loud, but it can be even louder. And as you were saying, part of that is capturing all these good practice models that we've been hearing about these past days, you know, and being able to see which are scalable and so on and so forth. So, yeah.
Can I say something?
Yes, Anna, please
Okay.
do.
So sometimes I totally agree with the two of you, but sometimes it's not the what to do, it's how to do it. And I think that this is what the group has been struggling for a few years, right? Okay, we know that those are the needs, but how do we do that? So yesterday I was thinking maybe we should take it a step back, and instead of saying, okay, what do we do? You know, I'm going to do early detection or clinical trials. We should group and reach out to an advocacy organization or, you know, to get not trained, but that can help facilitate the design, if you want, of a strategy for the region. Patient groups, they cannot do everything either, you know, you have a limit of things. So, I don't know, I would take it a step back because all of us are people that do things like, okay, I'm gonna do it, I'll do it. But maybe we need a strategist or somebody that can convene and, I don't know, but there are organizations in the region, you want a local organization that can help facilitate that. Or UICC.
Yeah, I think there are a number of, I would like to respond to what Anna said just now. There are a number of global webinars that take place, and these are for patient advocates and people who are managing programs around the world. And I think that we need to inform our groups in our countries, in all our Southeast Asian countries, and our members that there is this webinar taking place, and please join. So, you know that online is the way to go these days. You don't have to travel. Don't have to worry about your bag getting lost, you know, Rose. So I think that it is good for us to join those online webinars and learn from them, and then probably have something locally to add on to it, because you need the local flavor. You need the local adaptation. So yes, we take it from global, and then we try and adapt and use it. And then we go back to monitoring it and seeing how it works, because we lack the monitoring, we lack the re-looking at things and reorganizing ourselves. Rose, I know that it is rather challenging right now in Myanmar,
yes.
But we would like to hear your pearls of wisdom.
Yes, also we are dealing with, I'm the civil society organization and non-profit organizations, and our foundations, each and every one is volunteers. So it's rather easy to organize, and we have to overcome the challenges. So we got to survive these challenges, and we are doing what we can do. So the other day I raised a voice about closing the gap. So as I said on that day, the gaps, there are plenty, and we have a lot to do. So this Southeast Asia Breast Cancer Symposium is very unique. We have collective efforts, and it's not only for Myanmar, but each and every region in the Southeast Asia region, get-togethers led by Caroline, right?
Yes.
Yes, agree everyone. So why not form the coalition we have talked about in the past, SEABCS as well? Why not form about coalition or alliance or as regards this team, and then we can meet not only annually but maybe 3 monthly or so on virtually, and we can talk about locally, and we can listen to the other colleagues as well, right?
I think that's a
Thank
good
you.
idea, Rose, forming
you.
a coalition or an alliance where we meet up every few months. Okay, Winning.
Oh, thank you.
Indonesia.
Thank you. You know, these concerns about breast cancer numbers are keep on increasing. It's really a very sad results that happens year after year, and we don't know how to recover that. So I think maybe what we need to have is improve the or aggressively provide the training program for the health workers and so on, and involving also the organization like us, NGOs, so that we can reach the areas that cannot be reached by the hospital, because it is very important that us, we have a lot of communities that we can engage with easily, but we need to have a very good training program modules that we can deliver for them. So.
Thank you, Ning. I think you brought up a very important topic, which is reaching out to the hard to reach. So I think those are, very commonly in countries like the Philippines and in Indonesia, because you have like thousands of islands, isn't it? Very far away. So that's another area that we need to work on. Yes, so we have with us, what
Yes.
would Philippines like to say?
Yes, I'm Ramy Roxas again, and I'll be speaking on behalf of both the Cancer Commission that we just formed in 2019 and the Healthway Cancer Center, which is up and coming. It's actually just going to be the first cancer hospital in the country, but it will be up in July of 2023, and it's a private hospital, of course. And I think that says a lot, because what we learned in this pandemic in the country is private-public cooperation is essential for health. The government cannot do it alone. You need private initiative. The private sector has a little more flexibility to pivot and innovate, but of course, they only serve one segment of the country. And if you talk about Southeast Asian problems in healthcare, I remember my French professor in Singapore when I took a master's. He said the two biggest problems in healthcare in Southeast Asia are manpower, healthcare manpower, which we will continue to deal with, he said, even for the next 50 years. And the other one, of course, is access to healthcare. From our perspective, and I'm a surgeon, colorectal surgeon, so I feel a little out of place somewhat, but I'll tell you what I see from that perspective. But from our perspective also, it's pushing for standards and systems in assuring quality healthcare, particularly for cancer. And that's what we're trying to establish in the Cancer Commission, which is pushing for multidisciplinary discussions, because that's not common in many hospitals in the country yet. And then, of course, measuring outcomes. Again, another thing that's not common. So we want to set up in place so that doctors know how they're performing, and it's transparent and benchmark against each other. And then you talk about how collaboration is. We in the Philippines, at least within the medical doctors, are always amazed at how our breast cancer advocates are able to mobilize much better than the other cancers. So this SEABCS, for me, is a very important, and our breast cancer support groups, and I think they should be the model by which the other cancers can develop themselves. So this regional cooperation, specifically for SEABCS, should continue, and we will use that as a model for the other cancers eventually. Thank you.
Thank you, Dr. Roxas. I think you brought in some very important aspects, of course, healthcare providers, capacity and numbers, and also public-private partnership. And we have that in Malaysia, where we recently had an MOU signed between the Ministry of Health and a certain group of hospitals that are now going to collaborate on working with patients who are from the public hospitals under their services, or even allowing services. As you know, that the private hospitals, you know, their machines, their tools, they have, like just now Professor Yip was talking about how radiotherapy is much more easily available in private hospitals compared to the public hospitals, and you could utilize them for the public health patients as well. So thank you for that. But we have online, do we have Mr. Azrul's recorded talk? His input has been recorded. I think can we play that, please? Thank you. Before we go to the reactors, because we'll go to the reactors after you've heard all of them speak, and then you could respond to them. We also have two persons online as well. I don't know if Imjai is online. Are you ready? Yeah, you could proceed while I speak, and then I
Good
will
afternoon. I'm sorry that I can't be here to present in person, as I'm actually next door in the elder session. So I thought I would open the barn door here with a recorded speech and see what chaos I can cause without actually being there in the room. So I've been asked to speak about the possibility and potential of pool procurement, specifically taking a collective inter-country approach to the procurement of cancer drugs. There's been a lot of discussion, excitement and controversy over the years surrounding this familiar idea of regional pool procurement of cancer drugs, especially involving those which are innovative treatments, often available at high cost. As you have heard periodically during this conference, the lack of access to high-cost medications is a complex issue. It's not just about the medical arguments, but this ongoing concern lives at the intersection of economics, politics, and ethics. It is arguably a threat to the sustainability of healthcare systems and, in fact, global healthcare. This problem is more acutely experienced in low and middle income countries, or LMICs, such as those here in Asia and specifically Southeast Asia, where governments, households, and individuals are struggling to pay for treatments that could often be priced many times the average annual household income. As you know, differential or tiered pricing is currently used in healthcare, where drug prices are stratified in relation to the average national income, the country's economic status, and willingness to pay. Simplistically, this means that pharmaceutical products will likely be more expensive in high-income countries and more affordable in low-middle-income countries. As a result, the past decades have seen increasing coverage and access to treatments to the parts of the world which would have otherwise been either delayed or left behind. But the challenge to this approach have increased with new therapies being out of reach of affordability, patents and intellectual property rights seen as obstacles, and weakening of purchasing power due to fluctuating economic strength of countries and their currencies, especially today when the global economy is headed into recession. Pool procurement, where buyers collaborate and consolidate their purchases, is not new, but doing so involving multiple countries is looking increasingly attractive for those wanting to weather the storm, especially in this climate. There are four main reasons why countries may do this. First one is to contain costs. Second, to improve quality. Third, to increase the efficiency of the procurement process. And finally, to increase the diversity and availability of medicines or vaccines. But how do you imagine pool procurement involving several countries across an entire region? And what results can they bring against the promises made? A familiar example is the revolving fund of the Pan American Health Organization, or PAHO. Member states pool their national resources. PAHO acts as a pool procurement agent, negotiating with the pharmaceutical companies on behalf of member states. The results? High-quality vaccines, such as those for HPV, have been procured at 4.25% of their actual net cost. Now, my background in public health has been in the field of HIV/AIDS infectious diseases. Disease-specific third-party global health organizations such as the Global Fund to Fight AIDS, Tuberculosis, Malaria, the Global Drug Facility, the President's Emergency Plan for AIDS Relief, or PEPFAR, and Gavi, the Vaccine Alliance, have been able to provide access to affordable and quality antiretroviral medicine based on pool procurement principles. Most recently, we have seen this approach, for better or worse, being used in the COVID-19 public health emergency through the COVAX initiative, which have pooled buyers in Asia, the Americas, Africa, and Europe to procure COVID-19 vaccines and even personal protective equipment or PPE. Now, it has been a pretty bumpy ride for the COVAX initiative, but despite numerous challenges, including cash shortages, billions of doses were and still are being delivered to countries in need. For cancer, we have seen the Max Foundation implement this approach to a much smaller scale, allowing for patients in the countries where they have a presence to have access to much needed innovative drug therapies. So, can we replicate this for cancer drugs for countries in the ASEAN region? Though examples I cited, especially the South America model, can be used as templates, the honest truth is that we really don't know what could work in this region. Now, to help look for answers, we need to look at the following. Firstly, to participate in pool procurement, buyers need a sufficient level of technical and financial capacity, compatible laws, and regulations. COVAX got stuck when funding levels fell short of what was needed. Laws in Mexico prevented the government from procuring patented antiretroviral medicines through an international pool procurement mechanism. Secondly, to carry out pool procurement, there needs to be a pool procurement organization, perhaps in this case the ASEAN organization or secretariat. Data, bargaining power, and procurement decisions are centralized. Though this allows for efficiency, it does make the organization vulnerable to conflicts of interest and even corruption, especially if the workings are not transparent or independent. Finally, suppliers of cancer drugs must be sufficiently incentivized to participate in a mechanism such as a sufficient market size, reasonable and predictable negotiations, and most importantly, a prompt payment mechanism. What we have learned from the past is that pool procurement mechanisms are not standardized. There are no one-size-fits-all solutions. Different countries have different problems that they are wanting to address and solve. These mechanisms are complex, diverse, multi-component, and context-specific. They require a lot of work and effort by those involved. Most importantly, they require trust between individuals, governments who are participating. Not all countries and their economies were created and remain equal. Many have existing trade arrangements which may need to be revised, renegotiated, or even abandoned entirely if they were to participate in pool procurement. This is not about creating conditions which could lead to a possible race to the bottom, quote unquote, of prices, potentially leading to a withdrawal of companies from the market and medicine shortages. It is about finding the best way forward to gain equitable access to those innovative drugs which hold the promise of significantly improving cancer outcomes and saving the lives of those who otherwise would have been left behind. This is some food for thought in the coming discussion. Salamat. Thank you.
Thank you. Thank you, Azrul, because I think you hit the nail on the head. I think this needs a lot of thinking. It needs a lot of comparisons of trade agreements that the different countries have. And I think a lot of, you need to look at various aspects. You need to look at within the country and within the region. And you need to look at who's going to take on this responsibility. It's a huge responsibility. Max Foundation is a very good example. And I think maybe we should study those examples and see what works best for this region, which is quite diverse in some ways. Yeah. So I think we could now move on. I know that Professor Imjai is not able to join us online. So I've just been told about that. But do we have Finola? Is she online? Finola, would you like to come online and say a few words about what we're talking about? This is getting the ASEAN community together. Finola, welcome. And I hope you were together with us listening earlier on. So go ahead.
I think this is, good morning everyone. Sorry I can't be with you, I'm in the UK, so it's quite early in the morning. I thought that last presentation was extremely exciting. Can you hear me? Hello?
Yes.
Hello? Hello?
We can hear you.
You can, okay.
Yes.
Sorry for the delay. Obviously, I've had some real technical issues, but anyway, good morning, everybody, or good afternoon, probably for you by now. I thought the last presentation was extremely exciting. I can imagine this is something that perhaps really should be followed up. I'm not sure how exactly it could really be done, because the problems would be quite enormous, I think, but it would be really worth trying, because the price of drugs is getting off the scale, and if we could work together to do something, I think it would be far more powerful, obviously, to do it as a united force. And I also thought it was a very good idea to actually meet more regularly, rather than just once a year and then dropping the ball, because there's some exciting innovations, even for training, your drug pool procurement, many of the ideas that you've put forward. But I do think perhaps meeting together would be far more effective.
She's gone quiet again. Can you put on your audio, Finola? I can't hear you, Finola.
Yes, I know.
Oh, okay. It's on. It's on. Hello?
Hear you now.
Sorry.
Hello. Hello.
Yes, we can hear you.
Okay. Well, let me leave it at that, because obviously you're having problems and there's nothing more frustrating. But yeah, sorry, I'm having real technical issues this weekend. It's been very difficult to connect, and I think the issue is very much at my end. So yeah, but anyway, let me hand it back to you.
Thank you, Finola. Thank you for giving us that information. And Finola had also mentioned earlier on that they do some capacity building for medical, nursing, and technical staff in partnership with Bhutan. So that's another area that the Queen Sirikit Centre actually does.
Would you like me to share a little bit more about that,
no,
was it not relevant?
No, I think this should be enough.
Okay.
But we'll come back to you if we have more questions, Finola. Stay online with us. Okay.
Okay.
So, thank you very much. And now I go back to the reactors. I would like you to respond to what has been said so far, the menu that we put up, and the suggestions that the various people in this panel have actually given. So maybe we can start with Lorenzo Boffi.
Yes. Yeah, I mean, really, I think what I wanted to pick up is really the point that was made by Anna on the how. I think it's very important. I mean, we have all the relevant stakeholders around us, but I think it's how we do things together that really makes a difference. And I think UICC, as the global cancer organization, bringing together the entire community, I think we have at stake. It's part of our mission to make sure that we do the things in the right way. And one of our assets is really convening and bringing the stakeholders on the right table, and also making sure that there's the right themes that needs to be prioritized. So really excited to be part of this conversation and be able to see how we can bring our global commitments, and the work that we do with WHO, and also working more regionally. And on this, I mean, I think this is a beginning of other things that we can do together in the region. So in a nutshell, I mean, I'm not saying anything new, but I think it's important to stress how we can really bring all the different stakeholders together and focus on making a change,
Thank you for that. And what about Madeleine? What would you like to respond to?
A lot. They know me. I can talk and talk. Yeah. Okay. But yeah, I've been an ASEAN chairperson for 2 years when I was with the Department of Health, and all that have been expressed, we have been discussing that, but it's all discussions. Hopefully, ASEAN will, move further than discussions, because that's what ASEAN is. We just discuss and let the countries do the work. I mean, each country will have its own capacity and its own responsibility to respond to the policies developed during the ASEAN ministerial discussions. But again, how would each country be able to adopt what were discussed? Are we having, what happened now to the harmonizations of regulations? Where are we right now on drugs? We're talking about drugs. Are we having one common cost for the ASEAN? I've asked that several times. We should have one common cost for breast CA drugs and all the other drugs. Why can't we not have one? Because we don't really have a good costing analysis. I'm doing a costing analysis for breast CA treatment. It should have been just 3-6 months, but it's already more than a year now, and they couldn't get good data from our own hospitals, from the Department of Health hospitals. They're hiding the data from me. Why? I'm not going to eat their data. I'm going to work for it and make you, apply those informations. So there are a lot of talks, there are a lot of informations, really having those information work for us. And procurement, I have done a study on procurement. Bulk procurement has been, the Department of Health knows that. That's the only reason, the only way to do it. But because they say there's a law, et cetera. But international influence and international policy can also drive the country to work and to be on their foot.
Yeah, so the issue of getting the data from the Department of Health. Yes, I think a number of our countries have that problem because we cannot get data from our Department of Health. Do you want to speak something about that?
Yeah, I wanted to say something about that, because when in the advocacy for cancer, for better cancer care, we tend to lump cancers all together. And even from the treatment perspective, each cancer is different, right? Breast cancer is different from and lung cancer. Also, when we get to the context of advocacy and building, it may be better, in my perspective, to just focus on one cancer first. It might be more achievable. And so when we talk about data and coming together for medications, leveraging and all that, we can focus on breast cancer first. I think with this organization, with this meeting, and with the fact that we've noticed that breast cancer advocacy seems to be the fastest moving project, we can focus on that. Breast cancer data, the leveraging of breast cancer drugs, improvement of breast cancer treatment across the region, coming together with conferences like this, and focus on breast cancer as a model and as a benchmark for which the other cancers are built on. But that might be the more achievable way of doing it, rather than tackle all cancers together, which we should. But how do you make those systems better? Maybe one cancer at a time, or one group focusing on breast cancer and then let the other groups focus. Just my thoughts.
Yes, thank you. Actually, we are focused only on breast cancer here.
Yes.
Today, so we think that, like what everybody else had previously mentioned, that breast cancer really leads the way forward. And has any country got access to the breast cancer data from or their registries? The registries that are made public is something else, but there are other detailed data. Are we able to gain access to that? Is the government giving it to us in our different countries? And I would like the UICC to respond to that afterwards. Can somebody get Isabel in the room if possible? But Ning was going to say something. Yeah. So maybe Ning, you wanted to respond.
I think as a patient organization, it is even more difficult to get data from the from the hospital, or from who is the right person to approach to for data. This is something that we are always concerned, because we need to, whenever we are going to speak or to advocate about in Indonesia, the cost for medical medicines are so high, but we want to advocate about that. But we have to provide the accurate data, right? But we don't know how to get it. Who who we need to approach to. So this is something, because whenever we talk, I think the data is confidential, so we cannot get access to that. So we are stuck. Yeah, I think
so. The national cancer registries are open. Everybody can have access to it. All right, but it is anything else besides that which is in detail you are not able to get.
Yeah, but the national, yeah, I think the national is only for the public hospitals, right? The data from the
no,
from the
in our country it includes the private sector
yeah.
as well. Yeah. Carolyn?
So I think that advocacy organizations have a hard time producing your own data, right? That's a real challenge in the region. You know, so we've been working in Vietnam on our program where we partner with academic institutions, so both in the US and in Vietnam. So, you know, the partnership, if you can create these partnerships to help you build the data, they need the data as well. They need the research. So those are ways that we can, things we can look at to do together. How do we make those partnerships? How do we make those alliances to start to create our own data? That and then publish and things like that. So I think maybe that's a simpler place for everybody to start and then move out from there.
Yeah, that's very true. There is a model that we use for childhood cancer in Latin America and eventually in the Caribbean, where Childhood Cancer International, which is an NGO, partnered both with the governments and academic institutions, and we were able to get data from all the countries in Latin America, and eventually PAHO got so interested they funded the ones for the Caribbean. So now, at least in terms of childhood cancer, all of the essential data are needed, but you're right, there needs to be a multi-stakeholder collaboration for it to happen. So rather than on a country basis, we're having difficulties, so part of this regional collaboration, let's all do a mapping of the region in terms of essential data, and we have experts here could help us in terms of, you know, just 2 pages. That's what the government told us, just 2 pages. More than that is too much. But these were along the areas of governance, financing, stocks, And then after that, we just managed to get all of it together.
Yes, I think it's very true. And also the other thing is you could get only access to a certain level as a civil society organization. You gradually put your toe in first, and then you try and open the door a little wider. And when you get in, if they find that you are a threat or a chief disruptor, that's when they exclude you as well. So you've got to make sure that, you know, you sort of like, we need to know that they need to know we are helping the authorities, and we want to make things better for the authorities and for the country itself. I think we need the reactors to respond to this about how do we get data, how do we get to work closely, and how do we get to them to hear our voice and work together with us. So if the reactors could respond to it.
Yeah. One basic problem here in the Philippines, and I think it's also in other countries, is we don't have a data library of cost and others. And each hospital in the country, they have their own way of having their own information system, having their own, it's the typhoon.
Are we safe? Do we still stay
we're still
on
safe.
stage?
Don't you worry, I don't hear the howling yet. Yeah. So each hospitals here will have its own charting system. We don't have a common universal charting system. We don't have a common universal registration system. So that's what we have to have a library of data of the cost. I've worked with the health insurance. We have so many jargons in the country. Doctors, if you have 1,000 doctors, you will have 1,000 jargons. So we've been working on coming up with a common, using the ICD. Now we have the ICD-11, it's more complicated than ICD-10. So we have to have that in place as well. So all the tools are already in play, are already available. We just have to use them and apply them and be consistent. Because Filipinos are not consistent, I tell you. Filipinos are, or Asians as well, Asians, I guess.
Yes,
the
Southeast
consistency,
Asians.
you know.
That is why our food is very interesting and tasty, because we're not consistent with the food as well.
We have to be consistent and focused.
Yes.
That would apply also to Italians, because the food and the consistency, I relate a lot to that. No, but just to add on what was already said, I mean, UICC has a patient mentoring program which is really meant to address these kind of challenges in the sense of bringing together the stakeholders and the needs from the region so that we can elevate them within the stakeholders we interact with, such as WHO and others. So I think what is coming out now, this data, absence, let's say, is definitely something that we can pick on and make sure that we can create momentum around having a civil society movement that can make sure that this is advocated properly within the institutions that have data and we can reach. So.
Thank you for that. I actually have to wrap up. Our time is running out. So we were actually would like the UICC to give us a space for Southeast Asian countries to have mentoring or even workshop sessions, whether it's online or offline, I mean face-to-face, if it is possible.
And we are actually in the process of developing a regional forum for women's cancer that will be taking place in Q1 2023 in the region. We don't have details of exactly where, but definitely this could be a topic that we can focus on, and I think it would be very relevant given that we're discussing it now.
Yes.
So
do send the information to all those who are sitting on the stage as well, and any other people. But of course, many of us are actually UICC members already. Okay, so that's a very good example. The other one is, I think we haven't talked about the Asian Development Bank and some of the ASEAN bodies that we have, which are the economic bodies, so the social bodies that we can actually tap on. And let's give a think about what Azrul mentioned about the procurement together, which Max Foundation could be one of the examples that we could use. And we have to continue with the conversation, but we are short of time. I've been told that I have to wrap up. Wrap up? Yes. So I think that if we can have one sentence from each person, a short sentence, so then we'll wrap up. I've been given the permission. Yes.
Me?
Carmen, can you start? One sentence, short sentence.
One short sentence. Oh, I'll just share this quotation. It says, "Together we are stronger, our voices louder, and the synergy of our actions more powerful, and then change will happen."
Thank you, Carmen. Carolyn.
Well, this wasn't really, we didn't end up anywhere. We're back in the same place we started, which is what happens every year, and we don't actually come out with a plan to do anything, or we put it onto another agency to do it for everyone. So I think just start thinking about how we can actually do it together ourselves.
Yes.
And
well,
so with everything that has been discussed here, I think that a lot of patient organizations, what they could do is reconsider their advocacy asks. Maybe they're not the right ones. Maybe data, the access to data should be one, or, some of the other things we've discussed.
Another warning.
Another warning. Even if it's on silent, it goes.
Go ahead, Rose.
Yes. Yeah. A lot to do for women in the region and globally. So let's do it together for the better future. Thank you.
Thank you, Rose.
I think I very much support that we have to work together and collaborate so that we can have a better result to reach the target that we have to reduce the breast cancer cases in the world, or even in my country. Thank you.
Yes.
Well, a journey begins with a single step. And I think if you look at the meeting today, we all, you, everyone here in particular, has come a long way already. There's still a long journey to go, but we've come a long way. Thank you.
Thank you very much. I will take the initiative and set the ball rolling. I will take the initiative, set the ball rolling. I will send an email out to the representatives of the different countries in Southeast Asia to inform you what's happening globally and regionally. And I want you to spread that information and respond back as well as to what's happening in your part of the world. From there, we can continue to communicate and work towards more concrete stuff before we meet again in Hue.
Or even earlier. Or even earlier.
Oh no, that depends on the UICC. Okay, with that, I wish to take the opportunity to thank the panel as well as to thank the reactors. So let's put our hands together and thank them. So you will stay where you are. Do not get up, right? Am I right? That's what I've been told. Tell them not to get out of their seats. I would like to now invite Kara and your team. Kara from I Can Serve, and also Nicoy de Guzman, who is the president of I Can Serve Foundation, and Chrisan Keldron, who is the chairman of the board of trustees of I Can Serve Foundation.
Thank you, Ranjit. Only you could have pulled this off. A session we were afraid to do. But thank you, everyone, for joining us. But this is not the end. It's been a thrill and an honor for all of us at the I Can Serve Foundation. For Nicoy, Chrisan, and I, we're patient survivors for about 25 years for me, 20 years, and 23. This is probably the highlight of our journey as patients. We never could imagine from our hospital bed we would be here hosting. We are probably patients in search of meaning, or maybe meaning was searching for potential patient advocates. So it's an honor to host this. We now pass the torch to the next host for SEABCS 2023. It's coming full circle, going home to where it all began. We hope we gave justice to all the efforts of those who created this amazing initiative and fueled many dreams. Friends, please welcome Professor Tran Thi Thanh Hong of Hue, Vietnam. Over to you, Professor.
Please go ahead, Professor.
Yeah, thank you, Kara, for the introduction. My name is Htun. I'm the director of the Bright Future Foundation, the foundation to support for the poor cancer patient in Vietnam. And I'm a director of Vietnam National Cancer Institute. And I'm very happy and very proud to be part of the Southeast ASEAN Breast Cancer Symposium next year in the very beautiful city in the middle of Vietnam, is Hue. And I think that it is a chance for all of the healthcare professionals, survivors, the patient, policymaker, and academic to meet again and to work together to against the breast cancer and improving the quality of life for the breast cancer patient in the Southeast ASEAN and also in the world. And last but not least, I hope the all of you coming back home safe, have a safe trip to coming back home, and warmly welcome all of you in Vietnam next year. Thank you. And next year, I would like to invite the organizer to, we have a very briefly the video to interview about our country and to interview about the Bright Future Foundation. Thank you.
Thank you.
Welcome to Vietnam. Breast cancer is the most common cancer in women in almost all countries worldwide. The Bright Future Fund welcomes the 7th Southeast Asia Breast Cancer Symposium 2023 in Vietnam. This is the second time in Vietnam. This is our chance to update knowledge on cancer care's diagnosis and treatment, share ideas and experiences between cancer support groups, patients and survivors, health practitioners in supporting cancer patients and their families. Supportive Fund for the Cancer Patients, Bright Future, was established in August 2011. It's a non-profit organization operating in the field of humanitarian and charity to support, care, and treat cancer patients. In recent years, the Bright Future Fund has carried out various activities under the We Care for Her and Joining Hands for Her campaigns, including gift offering to cancer patients, organizing awareness-raising programs, and breast cancer screening for women in Vietnam. The Southeast Asia Breast Cancer Symposium 2023 will be held in Vietnam. Vietnam is located in the central region of Southeast Asia. It is a country with thousands of years of history, endowed by nature with majestic sceneries. It's also home of 8 natural and cultural wonders of the world, recognized by UNESCO. Hanoi, the capital of Vietnam, the city for peace. Ha Long, the charming and streaming city. Trang An, the ancient scenic spot. Phong Nha Cabanes, the magnificent beauty of nature. Hue ancient capital, a relic of the royal dynasty in the glorious history of Vietnam. Come to Vietnam to feel the beauty of nature, to understand more about the people, the abundant development potential, and the friendly and hospitable Vietnamese people. Vietnam, a multi-ethnic country with a total of 54 ethnic groups living together in the S-shaped strip of land. Each ethnic group has its own specific nuances in terms of ethnicity, culture, and festivals. Coming to Vietnam is also coming to a culinary paradise for visitors. Welcome to Vietnam, a country rich in tradition, a stable and developed country. A Vietnam join hands for the woman we love. Southeast Asia Breast Cancer Symposium 2023, Vietnam.
Thank you, Professor. We'll see you soon. Thank you to Kara, to Krisan, and to Nikoi, and also to Professor Tan. It has been a heartwarming turnover. I'm sure you're feeling sentimental, Kara and team. Let's give them a big hand. We will all take memories back from this symposium. Pleasant memories, lots of food, and I dare not stand on the scale. I walked into the room last night and I said, no, I'm not standing on that scale. So it has been one hell of an experience being with all of you in the Philippines. Thank you to all the volunteers from the Philippines. You've done a stellar job in hosting us, in making sure that we didn't get lost. And this has been an interesting session, and we will cherish this. And we express our support to South Asia Breast Cancer Symposium all the way. We will proudly wear our pink ribbon again and continue to wear the pink ribbon. Thank you, Carolyn. And I'm sure some of you are hungry now. So, and please remember the rooms are going to merge and we will have our closing ceremony at 1 o'clock. So please be around. And I would like to formally close this session. I hope everyone already has an appetite. Lunch will be served shortly. Thank you, everyone.